Hi, my name's Kate Bajcek and I'd like to talk to you about Chemotherapy and You. Chemotherapy isn't just one drug, it can be a combination of drugs. The treatments can range from just a short injection under the skin, an injection into the muscle, some intravenous medication, and that can take from 1 hour to 6 hours. It might be every day for 5 days straight, it might be once every 3 weeks, it could be for 6 months, for 6 weeks or for a year. So there's a broad range of experience and we're not going to know how you respond to it till you start. But what we do is we provide a recipe of treatments to try and minimise the side effects. Chemotherapy is not like it was 15 years ago. We have state-of-the-art drugs and we really don't expect you to have any vomiting, which is people's biggest fear. When you come into Lifehouse, you go up to level 1 and check in at day therapy. Now you've probably already had blood results taken because this will be your first session, so it's okay to use those blood results. But from then on, you'll have to get your blood taken at least on chemotherapy day and at best the day before. So we check your height and weight because the chemotherapy is calculated according to your individual height and weight. Your height's not likely to change, but you may put on or lose weight, and we keep an eye on that just so that we can adjust the dose properly. When you go to day therapy, there are comfortable treatment lounges. A nurse will attend you there and take your blood pressure and your temperature and put a needle in your vein, and through that needle we'll hang some lines and a combination of treatments. Treatments that are to prevent nausea and vomiting. When you go home after the treatment, you might have some niggling nausea and we want you to eliminate that. We want you to take the tablets that we give you should you feel any of those side effects. The pharmacist is also located on level 1 and they will provide you with your take-home medication and they'll give you an explanation of how to take that. It's a fully fledged pharmacy, you can take your normal scripts there too. Chemotherapy works because cancer cells don't repair themselves when they're broken. When the chemotherapy gets into those cancer cells, they're broken and they die. Whereas the good cells, they get damaged but they need time to recover. And that's why people's chemotherapy, depending on the sort of drug they're getting, are spaced apart so that you have enough time to recover all your good cells so that we can give you another dose. It's very important that you have your blood taken. It becomes a very integral part of the treatment and the nurses will be checking your blood results at the last point before we deliver your chemotherapy to make sure it's safe for you to have that chemotherapy. Some of these cells are red cells which carry oxygen around the body, your white cells which fight infection, and the clotting cells which clump together when you cut yourself. These are very important cells in your immune system. When you come for your first chemotherapy, you've already had your blood results taken, and that's going to be at a normal level. Then when we give you your chemotherapy, it's going to affect all your blood counts and they're going to drop down. The chemotherapy is spaced apart in treatment cycles so that you have enough time to recover those cells so that you're fit and safe enough to receive another dose. But what we say during that low period is that your ability to fight infection is impaired. We say that you are immunocompromised. So there's a whole lot of things that you need to understand about checking for signs of infection that might be different to how is normally experienced when you're not having chemotherapy. When you come for the second chemotherapy, the blood results aren't as high as before, but that's your new normal. You can also see that the blood counts come up for the next treatment. If you were to come 2 days before, 3 days before, they would be too low. We just have to send you home again. So that's the reason why we say you must have your blood result taken the day before chemotherapy or the day of, because every day makes a difference. In fact, for some people, when they turn up for chemotherapy, their blood counts might not quite be high enough, and we might just say, come back tomorrow. It's amazing what a difference a day makes in blood counts. A lot of people wonder about keeping up their vaccinations, and it's very important that you time it well. So if you're about to start chemotherapy in the next few days, it's okay to have that vaccination right now, but don't put it off and then want to have it during your cycles. If you do miss out and it's something that you really want to have, discuss it with one of the nurses so that we can time it when your blood counts are at their highest. Chemotherapy affects rapidly dividing cells. Now these are your hair cells, your mucous membrane, which is this pink lining inside your mouth that goes down your throat into your tummy, through the bowels and out the other end. And these are the systems that get upset by the chemotherapy. The nurses are always vigilant about asking you, have you been doing your mouth care? What we want you to do is to be very gentle with your mouth. It might become a bit tender. So what we recommend you do is not to have any dental work done during chemotherapy, because the mouth is an open port for infection to get into the body, and your immune response is down. So if there's any cuts or broken areas or bleeding in your gums, that's an opportunity for infection to get in the body. So what we want you to do is to get sodium bicarbonate. It's very cheap, you can get it from the baking section in the supermarket, and you put a teaspoon in a glass of water and rinse out morning and night. We want you to get a child's soft toothbrush and just do gentle polishing. And this will prevent mouth ulcers. Some chemotherapies affect mouth ulcers more and some less, but prevention is the best thing we've got, and keeping the mouth clean is a great way to prevent infection in the mouth. We also want you to drink plenty of fluid before and after treatment. Fluid plumps up your veins, makes your veins easier to find, makes everything in the body work better. One of the effects of chemotherapy is perhaps to be put off food or drink. Things that you normally like the taste of, the tastes and the smells might be changed. So what we recommend is 2 to 3 litres of fluid the day of chemotherapy and the 2 days after. So ways to get 2 to 3 litres of fluid into the body, it might seem overwhelming. Water is great, but if you're not into drinking water, put your favourite cordial in it. A bowl of soup is 350 mils. A jelly from a packet made up is 500 mils. So if you have a bowl of soup and a jelly, that's already nearly a litre. And then if you fill a bottle up and then drink it down and empty it, you can see how much you've had to drink. So it's better to start off with a bottle of cordial or fluid next to your bed in the morning. Start sipping as soon as you wake up. If you really can't stand drinking, put a straw in it. It doesn't feel like you're drinking so much when you drink through a straw. Ice blocks are also a good way to get fluid into the body. So if you had your jelly, your soup and a couple of ice blocks, there's a litre. So that's nice and easy. It doesn't seem so overwhelming. So don't forget those sources of fluid as well. Your skin is your major organ. Some chemotherapies make you very vulnerable to burning. When you're approaching winter, you're more likely to have long sleeves on. You're not likely to spend that long in strong sun. But definitely in the warmer months, you need to have a hat on, you need to wear factor 30, and you need to have long sleeves. Some people have got burnt just from walking across the road in the midday sun after having their chemotherapy, going to their radiation appointment. That's how vulnerable the chemotherapy can make your skin. Bowel care is very important. Some chemotherapies cause constipation and some chemotherapies cause diarrhoea. Some of the drugs we give you for nausea cause constipation. So sometimes the combination of drugs makes you feel none of those side effects at all. Everybody over 40 should be introducing more fibre into their diet because the body slows down. Chemotherapy slows down the body even more in its elimination processes. We recommend that you have whole grains, that's whole wheat, whole grain bread, whole rice, brown rice rather than white rice, and 5 to 7 serves of vegetables every day. 2 of those serves can be fruit. If your normal is to go to the toilet every day and you miss a day while you're having chemotherapy, you must take something. We want you to eliminate those wastes from your body as quick as possible. We don't want them hanging around. So you can try Nulax, which is like a big block of compressed fruit, prunes and dates, squashed down to a piece about that size, and you break off a walnut-sized piece. If that hasn't worked, you need to take a laxative like Caloxylin Senna. Take 2 tablets morning. If nothing happens, take 2 tablets at night, and then contact the nurses in the day therapy centre if you still haven't moved your bowels. Some chemotherapies do tend towards causing diarrhoea. And what happens with diarrhoea is that you're losing too much fluid too quickly from the body. The kidneys haven't had a chance to really flush out the toxins from the chemotherapy. So it's very important that you keep up enough fluid. It might be the last thing you feel like. But a very good diet is the BRAT diet. It stands for bananas, rice, apples and tea, BRAT. Bananas are full of potassium and they also bulk up the bowel and draw fluid away. So it tries to slow down that rapid release that's happening through the bowel. The rice also clogs up the bowel a bit, the white rice. And applesauce or stewed apples give you that little bit of sugar and flavour, and black tea, tea without milk. This is your rehydration diet, your BRAT diet, until your stools return to normal. You should commence that diet when you have a few episodes of diarrhoea, but if you have up to 4 episodes of diarrhoea, you should get some GastroStop before you go home so that you have it in the cupboard. And if you're having 4 or 5 episodes of diarrhoea in a day, take 2 tablets at the time that you have your 4th or 5th episode of diarrhoea if you feel that it's really intolerable. And the packet tells you about how many you can take. So it's very important that you get on top of diarrhoea quickly. So what about eggs and sperms and fertility? If nobody has had a conversation with you about this and this is something that you'd like to discuss, contact one of the nurses in day therapy. These are some of the important factors that you have to learn about reasons to seek medical advice, and by that I mean coming to an emergency department. Now remember when I said that when your white counts are low, that means your ability to fight infection is impaired. So what you might feel is maybe hot and cold, achy feeling. Don't take 2 Panadol and go to bed. Take your temperature. Now you have to remember this. If your temperature is 38 or over, you need to get to an emergency department. You need to start treatment within 4 hours. What we need to give you is we need to give you large doses of intravenous antibiotics and fight the infection for you. If we don't do that, a simple infection like a cold could become a life-threatening pneumonia within 24 hours. So a temperature of 38 is a sign that you need to act on, so make sure you get a thermometer, just a cheap $20 one from the pharmacy that's a digital one. If you have continuous diarrhoea, that means you're not flushing through slow enough the chemotherapy through your body. So we need to replace that fluid, and that can only be done in an emergency department. The other reason would be if you had persistent vomiting or persistent nausea so that you couldn't even keep fluid down because the thought of drinking just made you feel like retching, and that was to go on overnight, you're also not getting enough fluid. Remember, you have to drink 2 to 3 litres of fluid for those first 3 days of treatment, the day of treatment, the day after, and the day after that. So if you're not getting that through because of nausea or vomiting, you need to come into the emergency department. If you're walking along a flat surface and you're suddenly out of breath, you put your hands on your knees and you hunch over like this and you go like that, that would be very unusual. Perhaps your red blood cells went down way too low. So that would be a reason to come to any emergency department and just to make sure that you've got enough oxygen circulating to keep all your organs working. There's no necessity to get in an ambulance. You could call a taxi, you could get someone to drive you. Just go to your nearest emergency department. Between Monday and Friday up to midday, you could come to day therapy for any of these symptoms, and the nurses are well equipped to start that treatment for you. Outside of those hours, you'll need to go to your nearest emergency department. Make sure you tell the doctor about all the regular medications that you're taking and make sure you take them on the day of chemotherapy. If you're having any complementary medicines prescribed to you and they're prescribed by a Lifehouse practitioner, then you may continue to use them. But if they're prescribed by a practitioner outside of Lifehouse, we don't recommend that you continue with them because we don't know the side effects. It is recommended that you have no more than 3 portions of meat a week, no bigger than the size of the palm of your own hand. The serve of protein for the other days of the week, whether they're a combination of legumes and tofu, fish, chicken, the size of the palm of your hand. A serving of fruit should be the size of a fist, so should a serving of vegetables. The guidelines are that you eat 2 servings of fruit and 5 of vegetables every day, particularly green leafy vegetables. The size of oil in a day should be the size of your own thumb, and you're allowed to have a few treats and you're allowed to have a glass of wine, but you have to have a glass of water to follow it. If you're feeling fatigued, the last thing that we want you to do is take to your bed. It's much better for you to be in an upright position. By all means, have a nap. Don't nap later than 3 o'clock in the afternoon or you'll upset your sleep cycle. And try and include some light exercise. Walking is one of the best exercises. When you swing your arms like this, it's moving the muscles in and out in your lungs and it's helping to pump through your blood supply through your body. It's hardly an effort at all. And when you move your legs like this, that's actually moving your bowels along. So it's very important that you do some light walking and include some nice big breaths while you're walking. If you already have a gym membership or go to a yoga class, you might just be operating at 60 or 70% of your peak. But by all means, keep that up. It's evidence-based research that continuing with light exercise during chemotherapy actually improves fatigue. A loss of interest in sex during times of ill health is very common. It would be completely normal to have a loss of interest in sex from a lowered libido. We have to talk about body fluid protection because the chemotherapy is cytotoxic. Cyto means cell and toxic means causing damage. And the body fluids in your body are cytotoxic for 7 days. So it's very important that you consider the people around you. When you go to the toilet, the men should sit down to pee and then close the lid. So everybody should close the lid when they flush and use a full flush even for urine. There is a microscopic spray that comes out when you flush the toilet, and we know that it takes about 4 hours to settle. That can be inhaled. We don't know the side effects of chemotherapy on people who aren't having treatment for cancer. What we do know is that it does exist in aerosol form and mostly unchanged in urine, especially in the first 24 hours. But we ask you to consider that all your body fluids are cytotoxic for 7 days. So if you're going to have sex, you need to use condoms. If you need to come to an emergency department, you need to tell the staff in the emergency department that you've had chemotherapy in the last 7 days. If you're taking chemotherapy tablets every day, you are going to have cytotoxic body fluids all the time. A lot of people are worried about kissing. Kissing on the cheek and hugging is a completely safe activity that requires no barriers at all. As long as you haven't been profusely sweating on a humid day, just dry yourself off. People are worried about kissing babies and kissing their children and loved ones, but that's something that we encourage. It can be a time of great turmoil in your life, and the nurses are very experienced at responding to your anxiety. Some of the anxieties you might have, are the nurses doing the right thing? Is this prescribed properly? Is it working on my cancer? I've had to wait so long, all of these things. It's very helpful if you can kind of slow that process down and be very much in the moment, like what is about to happen now? And here I am, I'm having treatment, and trying to let go a little bit. It's easier said than done, but there's great people in this hospital, counsellors, there's feedback sessions with other patients that can help you to manage some of those shared experiences. So it's very important that you help us to help you by telling us what you need. The Lifehouse Lounge is your space. It's a great place to wait for chemotherapy. It can be quite stressful waiting up in the day therapy lounge. It's a place where there aren't any medical staff and there's a great space there with the sun streaming in. So go and check out the Lifehouse Lounge. I wanted to give you a word of caution about blogs and about searching the internet. It's important that the information that you're hearing comes from a reputable source. All the practitioners within Lifehouse are giving you information based on evidence. Be careful about what you hear from well-meaning neighbours and family members. A really good site on the internet is the Cancer Council if you're looking for more information. The booklet that we give you and the DVDs are also very good sources of information. And of course the nurses and your treating doctors are the best people to listen to. With your parking, you can have your tickets verified and get 50% off by taking it to one of the receptionists. There's a Lifehouse shuttle bus, there's a volunteer driver's service. We're here to help you through this difficult time and we can get through this together.